Good morning. My name is Hillary Ridd, and I am the Adult Services and Workforce Consultant at the Kentucky Department for Libraries and Archives. I'm delighted to be here with you today to share the webinar, Hosting a Health Fair at Your Library. This webinar will be presented by Holly Darty. She is with the McCreary County Public Library. She does programming for adults and children. And so the webinar today is being recorded and captions are available. I'm going to drop these in the chat. If you need captioning, you can utilize this option I put in the chat. And then my colleague Kim has put in information about sound and any kind of troubleshooting. So I'm going to share Holly's slides here, and we will go on and get started. So delighted to have Holly with us, and look forward to hearing her share. This webinar is being recorded, as I said, and you can access the recording and so forth at later time. Your continuing education credits, if you're attending for today, those recording and so forth information will be made available within a few days, a week or so. So if you have any questions, please type those in the chat. And if you would like, please type what library you're with and your name in the chat as well. And without further ado, I'm going to pass it over to Holly. Thank you again, Holly, for being here today.
Absolutely. Thank you guys for having me, Miss Hillary. Thank you to each and every one of you guys that are attending. So like Hillary said, this is hosting a health fair at your library. I am the youth and the adult programming coordinator here at McCreary County Public Library. So I handle pretty much all programs here at our library. From start to finish, my hands are in these programs. I actually worked for this library for about 3 years, left for a small little intermission and went to work for our local school district, and recently came back. I've been here now about a year and a half, and this actually was one of the first programs that I brought back to our library when I returned. Just on a daily, kind of flow of patrons, seeing what the needs and stuff was out there. Not sure if you guys deal with a lot of homeless or, less fortunate patrons, but what we were seeing was just the need for resources and health resources at that. So I instantly just kind of went to, nose to the grindstone, trying to figure out what we could do as a library to make that happen. And this is how a health fair at your library came to be. So welcome to each and every one of you guys. As I go through, if you have any questions, please feel free to drop them in the chat. I would love to answer questions. That's ultimately what it's about. That's how we feed off of each other and we learn from each other. So we're going to go ahead and get started then. Why should you host a health fair at your library? That may sound strange to a lot of people. A library is books and that kind of thing. But truth be told, in today's society, a library is so much more than books. We need to promote our library as that. We are more than books. We got to let them know that we're more than just the books on the shelves. We are here with multitudes of resources. You want to get the word out about health and wellness in your community, because sometimes you may be a new stop for a new family moving in. You may be the families of, the faces that you're seeing of these families with, your babies, your toddlers, your school age, all the way up to your senior patrons. So they come to trust you. They come to rely on you. So you are going to help them to find out what resources are out there for the health and wellness in your community. This also lets you kind of have hands on the ground with those community partnerships. That'll be one thing you'll hear me say time and time again. Community partnerships matter. We have to bond with other people in our community to form those partnerships, to form those bonds. It is crucial. This health fair will allow that. You will be able to partner with so many people, from doctor's offices, dentist office, opticians offices, your extension offices. There's so many resources out there that you're going to be able to partner with for this event, but also open up the doors maybe for other events at your library. So new library patrons, new faces, maybe they have never darkened the doors of your library because they don't think they need your books. But if you say, hey, come in today and get free HIV testing, come in today and get a free flu shot or a free COVID shot, come in today and get free blood work, free blood pressure, they very well may come when you say free. So when you get them in there and they actually can see what your library has to offer, you're going to gain a new library patron. You're going to gain a new face, a new patron that's going to learn to trust you and love you guys. It will give you an option to promote your own programs. If you're like us, you do a monthly calendar. I do a monthly calendar for our adult programs as well as our children's and youth programs. Promote those at these types of events. When you've got new people and new faces, give them a calendar, give them the details of what your library is going to do, and you're going to win them back. They're going to want to come back once they see that you're more than books. So these are just a few little snapshot reasons of why should you host this at your library. Plan and take action. By nature, I am a planner. I am an organizer. They laugh at me here at my library because my calendar is color coded. I am such a planner and an organizer, and that is ultimately what it takes to pull off an event like this. Planning has to start immediately. As soon as you say, we're going to do this, you got to set a date, first and foremost. Set that date, get it on that calendar. That gives you what you're working towards. Will your health fair have a theme? Ours did. It was the 1st of January. New Year, New You was our theme. First of the year, everybody wants to get healthy. They want to know how to eat right. They want to know what resources are in the county that are free or not very expensive for getting healthy. But so that's when we aim to do ours. New year, new year, start new year, new you, start the year off right. That's ultimately what it was about. We wanted to set goals. What do we want for this? What do we want out of this health fair? How many organizations do we want here with us that day, promoting, their things as well? How many attendees do we hope will come, through that library and gain those resources? So once you set those goals, you're going to kind of know what you're working towards. Also, setting those goals, especially looking at like the number of organizations or businesses that you're going to have, that's going to need to depend on the size of your library. I mean, we are a very rural library here, but on any given day at any program, I mean, we could easily set up 20 or 30 people if we strategically plan. So that's what it's always about, is finding out, okay, the logistics of it. Where are we going to set them up? How many can we have? Tables and chairs, do we have them? Are we going to have to borrow them from another organization? And that's what we did. We borrowed tables and chairs from a local church that is always willing to partner with us and help us with these types of events. So we had tables and chairs here, but maybe not enough. So we knew that we had that community partner that we could rely on. Well, once you kind of have your goals set and you have your budget set, that's a thing. Figure out what it's going to cost your library to do this. This is honestly a program that you could probably do for minimal cost, depending on who you partner with and how you partner with them. Some organizations will donate your door prizes. They will donate your tables and your chairs. They will donate, maybe whatever they can, which will limit, what it's going to cost you on budget. And you're going to want to look at, contacting those local organizations once you have your goals and everything set. So, because you're going to know how many you need, what type you want, and whether it's doctor's office, dentist office, if it's, behavioral therapist, speech therapist, any of those types of things, you're going to want to know who you want to contact and how many you can contact to make that event happen. Determine what outcome you want from this event. What do you want from this event? Do you want to just host it and say that you hosted it? Or do you want true, intimate takeaway? Do you want to gain new patrons? Do you want to gain their trust? Do you want to gain partnerships that are going to last outside of this program with those community organizations? You have to look at what you're going to want your library to take away from this event. Community partnerships and involvement. Like I said, you will hear me say this over and over and over again. I am a firm believer in supporting local, shopping local, and being a community partner. So as you'll see here in this slide, this is just a couple little snapshots from our health fair. And I've listed some of the organizations that we had here on that day. Of course, we sent out an invite to our health department, our Adonta group, local doctor's offices, local dentist offices, Connect. If you guys are like us, your Connect people are always reaching out for a way to be present in your library, and this was a great way to include them. Local extension office. Maybe you're not partnering with your local extension office. Let me tell you, if you are not, you are missing out. There is so much partnerships to be had within those local extension offices. Recovery programs, homeless shelters, your EMS. Guys, whether it's kids or whether it's adults, we know the kids love to see the trucks. So having that truck here on that day was a great filler for our kids. They love to get in, they love to see, they love to explore, they love the lights, they love the sirens. But ultimately, it lets us as adults see inside that truck too. Well, I mean, ultimately to know, God forbid, if you ever need it, this is what it's going to look like. And these are the people that are going to be taking care of you, putting a face with a name. You hear about your EMS all the time, but it's always good to put faces with names. If you guys are like us, we do not have a homeless shelter here in McCreary County. And that is a huge struggle of ours, because I have nowhere to send our patrons when they come in homeless, and my heart breaks. So I have literally scrounged to find any resource that I can get to help. So have those homeless shelters here on the ground on these days is so crucial, because I mean, honestly, it gives you resources to keep and have on hand. But you can tell your homeless patrons, hey, on this day, we have these people here and they're going to help you. And so we just recently got a recovery program here in McCreary County. And so now it's good to have them here on the ground. So you can tell your patrons when they come in looking for that as an option. They're going to be here on that day. They can talk to you. They can tell you so much more than I can tell you. Having those faces to put your patrons in touch with is crucial. I'm looking at another slide for more community partnerships and involvement. Local home health services, Lifeline, any of those types of things. American Cancer Society. Our library actually partners with our American Cancer Society, and we actually host all of our Relay for Life meetings and everything here at our library. I am actually one of the chair people for our American Cancer Society Relay for Life committee. So having them here to know what resources are available for cancer patients in your county is crucial, but it also gives us resources to help those patrons even after the health fair day. Invite your local gyms. All of our local gyms were great for this event. They're like, hey, I will give you a free month gift certificate just for sponsoring or advertising about our gym. They will partner with you. They want their name out there just as much as you want them here. Local martial arts or yoga studios. We had both of them here at ours. You can do martial arts or Tai Chi demonstrations. You can do yoga demonstrations. You can have a table set up for them. But even outside of that, look at how your life can partner with them year around. That's what we do. We offer yoga once a week here at our library, all because of these partnerships from these health fairs. Clearing the Air Coalition here in McCreary County. They were here doing surveys about the health and the wellness of McCreary County, and smoking and vaping and those types of things, drug use. It is a huge, huge resource. Having hospice here or your local hospitals. We do not have a local hospital here in McCreary County. Our local hospital is Pulaski County, roughly 30-45 minutes away from us. So having them here to talk about what resources are available at that hospital, because our local hospital also has a hospice wing. So those two community partners can tie in together and talk to your families about what they can do. Local obstetricians offices. We had local eye doctors here working with our Lions Club, giving free vision screenings, talking to our patrons about if they couldn't afford to purchase their eyewear, their glasses that maybe that they needed. There's always ways of working around that. Our Lions Club can help with that. Christian Care Centers, our local Christian Care Center, usually will go about $50 on a pair of eyeglasses to help our patrons. We've done it, been there, done that. I had a patron come in and hers had been broke, and they were living literally just, I mean, I'm going to say homeless. They had no electric, no water, really no resources. They were living like in an abandoned trailer. And she needed her glasses fixed. And so I reached out to one of our local doctors, eye doctor offices, and our local Christian Care Center, and was able to work out for her to get glasses. And it did not cost the library or that patron a dime. They took care of us. So these community partnerships are so crucial and so important. If you get their name out there, they're going to support and help you. Free screenings. That is always a bring-in ticket. When you put it out there, free, free, free. We know if you say free, they will come. So, and that's exactly what we did. A lot of people are like, medical's expensive. I can't afford to have that test done, or I can't afford to do that, or maybe I'm afraid to have that done. But we did this. We reached out and talked to all of those community partners that we had here for our health fair, and we're like, what can you give our patrons for free? We're dealing with homeless patrons or less fortunate patrons, or even just myself. Even like, I was able to take advantage of some of these free screenings. Blood pressure screenings. I mean, you'll see that top picture up there is actually our library director, Mr. Grady. But I mean, even like, he took advantage of, having his blood pressure checked on that day. Diabetes risk assessments, mental health screenings. I mean, those can be just as simple as filling out a little survey with someone that day to know if maybe they're having depression issues, or some type of anxiety issues. They can look at your health and your weight, and you can talk with local dietitians about if there's an issue with your health or your weight. Like I said, we had eye doctors here doing free vision screenings and working with our Lions Clubs and local obstetricians offices. Hearing screenings. We don't always think about our hearing until it's kind of too late and like, oh, we're having an issue. But we can do those here and for free, and know if you're having any issues with your ears. We partnered with our local health department and with UK, and was able to offer free HIV testing. Anybody that tested for HIV on that day got a free gift card to Kroger. So all it took was a matter of minutes for them to come up, get tested for HIV, and they walked away with a free Kroger gift card for gas or food or whatever. So you're helping your patrons who maybe would not have that as an option, or just truth be told, maybe they're too scared. But this kind of let it be a safe environment, a loving environment, and maybe not such a sterile doctor officey feel environment that they could walk in, and we provided them with a private room and, private restroom and everything to have all of these, HIV testing and other testing done. They were actually able to be COVID tested on site or get a vaccine or a booster if they needed it through our local health department. So we try to make it like a one-stop shop for everything that they need. So health fair for all ages. When you're planning, don't just think adults. I know that's instantly what comes to mind, but think about your kiddos. Think about all those kiddos that grace your doors every single day at that library. What can you offer for them? What can you, give as resources to their parents who maybe are so unsure? Same thing with them. Do those vision screenings. Maybe they're getting ready to start school, and this is a free vision screening before they start school that didn't cost that family anything. Dental screenings, partners like that. We have dental offices that go into our schools who will also partner with us here at our library to make sure that our kids are where they are at, needing as far as any type of services for dental. Behavioral screenings, maybe you have a parent that says, I think my child is on the autism spectrum, or, maybe we're having some behavioral issues really bad. I mean, if your families are like ours, like I said, I'm the children's librarian too, and I hear it all the time. I mean, they'll come in and be like, I'm so concerned. Well, having these here gives that parent a safety net to fall on. They know that I'm here for one thing. I'm going to support you and I'm going to love you through whatever that shows. Just because of something that shows on that behavioral screening, you are there to be a resource and to piggyback on whatever the need may be. Early childhood development screenings. Every child has to be screened before they go into preschool here in McCreary County. We were able to partner with our school district to offer those early childhood development screenings. That way, if your child is not on par, you can figure out what resources the library or other agencies can offer to get your child where they need to be school ready. So it all falls back to whatever this screening may show, how can you use that at your library? And that ultimately opened up a new program that we started here at the library about 3 weeks ago or so, preschool story hour, where I do story hour like a normal fun story hour, but I'm embedding some of those early childhood development school readiness skills into that because of what we were able to see on these free screenings that maybe some kids in McCreary County were lacking. They can get height and weight screenings. They can get vaccines from our local health department to be up to date on vaccines to go to school. So a health fair is not just for adults. Be open-minded and think about all of your patrons. Tips for a successful health fair. Promote, promote, promote. I will say that over and over and over. That is ultimately what it is about. Whether you're promoting on Facebook, TV, radio, paper flyers, snail mail, whatever it takes. Get the word out there. Promote it, promote it, promote it. Have your agencies that are going to be joining you promote it. Consider all of your advertising platforms. Create that Facebook event. Create a flyer to share out on, Snapchat, TikTok, Instagram, any of the platforms that your library uses. Get the word out there. Target your audience. Know what you are posting and sharing about. So use those platforms and promote. Talk to your local journalist at your newspaper. See if they'll run an article for you. Talk to your local radio DJ. See if they'll let you come and do a small little radio spot about it. Both of those are great here in McCreary County. I can send them anything and they will put it out for us for free. So use those platforms that are there and readily available to you and your library. Door prizes and incentives. Like I said, if you say free, they will come. The more door prizes and incentives you give, the better. So a lot of your organizations will give away their own incentives at their tables. but partnering with some of the people like local gyms, local, massage therapists, different people like that, they'll give you gift cards. You can do a raffle, have everybody that comes in that day fill out a ticket, door prize drawings on the hour, every hour of your health fair. Keep people coming because free is going to win them in. Feedback from your participants. This is going to probably come, at the end of the day or even in the days to come after your health fair. Evaluate, get that feedback from your participants. What, from your patrons, what worked. Even have a small little survey if you want for them to fill out, the day of. What can we do better? What would you like to see here next year? What did you love about our event? Those types of things. Let them have buy-in. Let them know that they have a voice. Feedback from your organizations, same way. Evaluate them. A small little evaluation, via email or paper or whatever it may be after your event. What did you like about this event into the library? What would you want us to change? Would you come back and do it again with us? Would you recommend another organization to join us next year so we can continue to grow it and expand it every single year? Ultimately, that's what it's about. We want to pull away the successful components, but we also want to look at the negative components to make ourselves better, because it's always about bettering ourselves to make things better for our patrons. Free classes or activities. Like I said, you'll see right here a small little snapshot. Yoga classes, meditation, chair aerobics, chair massages, pound classes, healthy cooking and tasting classes. All of these are programs that our library offers now because of these events, because of these partnerships. We offer yoga classes once a week now. We offer meditation classes once a month now. We do chair aerobics classes twice a week now. Chair massages we offered day of the health fair. Pound classes we do once a month here at the library. Healthy cooking and tasting classes. Going back to partnering with your local extension offices. They can do this. They can give you those healthy cooking recipes to share with your patrons, but they can also do programs where they actually are teaching your patrons how to cook those healthy foods and taste those healthy foods. We do cooking classes with our adults and our kids by partnering with our extension office. So, day of our event at the health fair, we had these people here and we offered these free classes so people could come in, try them out on that day, see if they liked them, talk with the trainers, talk with the presenters of these classes for those one-on-one personal questions. Maybe they're a little unsure about it, but that closeness on that day of getting to talk with those people before, doing the program or even attending the program at the library, it opened that door. It set that bridge work for our programs, but also for them to utilize those people outside of the library. Like I mentioned, martial arts. We have hosted martial arts classes here, but now it has now expanded and some of our patrons are utilizing them off of our campus. So these are free classes and activities that you can have day of, but also open the doors of your library for a new experience. So that's just kind of a little snapshot. I may have actually went a little too quick, but that'll give us time for questions and those types of things. But I just want to say thank you to each and every one of you guys for joining us today. Like I said, if you have questions or comments or suggestions, drop those in that chat box. That's what I'm here for. We learn from each other and talking with each other. This is one event that I am truly so very passionate about. I actually used this little picture down here. That is actually me having my blood pressure checked the day of our event. And I'll tell you a little funny story behind that event. I sat down for that to have my blood pressure checked. And I told him, I was like, oh, snap my picture. It'll be a good picture, for us to use for promo and da da da. I sat down to have my blood pressure checked, and my blood pressure was through the roof. And they were like, do you have blood pressure problems? I was like, no, I do not. It was so high that day. And it could have just been the stress of the program, maybe me running around back and forth. But I sat down there, and the lady in the red at the table was actually a doctor. And she's like, I'm going to advise that you take a few minutes to chill. She's like, and then come back and let us recheck your blood pressure. She said, because it is very high. So they actually sent me to another doctor's office that was on the grounds that day at our health fair, and had it checked manually since theirs was done on the electronic device, and it was still high. So I actually walked away from our health fair being sent to a local doctor's office for more of a consultation. So even when you think you're fine, these free screenings at these health fairs may find something that you did not realize was a problem. So it's always a good option just to host these and let your patrons, find out for themselves if they really are in need of, some of these services. This is just another little slide, just easy ways to get in touch with me. If you decide that you want to do this and you want to plan it and get everything going, um, feel free to reach out. I am an email, a phone call, anything away, and I would love to talk. I'm a huge talker, and I love meeting and greeting with other colleagues that do what I do. So this is just my email address, hollydmcpl@gmail.com. And then you can find me on Instagram, Miss Holly at MCPL, or Facebook, Miss Holly at MCPL. And then that is the library number, and you are always welcome to call me or message me or reach out in any facet whatsoever. I would love to hear from you. So I guess that's kind of it for me right now, Miss Hillary. If we want to open up to questions.
Yes, that'd be great. If you've got questions, please put those in the chat. I actually wrote down some things I thought about as you were talking, Miss Holly. So folks, please feel free to type your questions in the chat. One of my questions, I'll go on and get us started, is how do you plan and book for those those who are going to be there? Do you overbook in case somebody cancels, or how do you handle people canceling, or just your booking process? What's that like?
Okay, so kind of going back to, looking at our goals, you're going to kind of need to know the number that your library can hold. So what I always do is I book to that number. I book 100% to that number. And then I do a wait list. Anybody else that may want to attend, I do a wait list. And I always tell them I will start checking with my people, probably 2 months out, a month out, different things like that, setting those targets. And if anyone backs out, I immediately go right to my wait list and I start pulling them off and, plugging people back in. So that way we always keep our numbers. But I start with a set number, I fill that to the brim, and then I go to my wait list.
Great. No, that's wonderful. My next question is, how did you develop these partnerships? What did you do to develop the partnerships you got?
I will be really honest with you. I am just a people person. I will talk to anybody about anything. I have been very blessed. I have served on numerous boards in McCreary County. I have been Chamber of Commerce president. I have done leadership classes here in McCreary County. Like I said, I've worked for the library for years on and off, school district on and off, different things like that. So these are just partnerships that I have literally just, reached out and just said, hey, I would love to partner with you for this. My kids did karate, and that's how I got in touch with the martial arts gentleman. Different things like that. So look at who you know within your community and how you can start bridging, those partnerships. As soon as I hired in, I immediately contacted our extension office because I serve as our extension office chairperson. I am their board chair. So I knew the resources that were there in our community that were not being tapped into. So I immediately reached out to them and I was like, I know you can, talk to us about healthy cooking. I know you can offer chair aerobics. I know that you can even teach like arts and crafts and different things like that through, because you have an ag agent, you have an FCS agent in your county, you have all of these different people within your extension office that you can utilize. So I literally just started making phone calls. Don't be afraid to send an email or pick up that phone and call, your local doctor's offices, your health departments, your eye doctors, your, massage therapists, your gyms, any of those, and just say, hey, I'm such and such from da 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 library, and I'm doing this health fair, and I would love to have you guys in. I would love to promote your business. I would love to partner with you. Don't be afraid to make that contact. I know a lot of people may not be as, peoply or as outgoing and stuff, but don't be afraid to make that call because ultimately you're going to help their business and you're going to help your library. And it's just amazing, what a simple little phone call or an email can get you. So don't be afraid to reach out and do it.
Thank you. Folks, if you've got anything, feel free to put those in the chat. I have another question for you, Miss Holly. So you mentioned the screenings and so forth. How did either you all as the library or did the community partners handle privacy issues and HIPAA? Were there concerns? Did they have concerns? And how were those kinds of things addressed? I know you also mentioned HIV and the logistics for that. So I guess could you touch on both of those things, privacy and HIPAA, and then logistics for room set up for the HIV testing?
Absolutely. So what we did within our community room, and that's actually where I'm at now. You'll see all these books and everything behind me. This is actually our old library director's office, and it is actually off of our community room. We have a kitchenette and a restroom off of our community room. We have a couple other storage rooms, different things like that off of our community room. So whenever I was looking at the logistics and talking with our partners on what do you need to secure the privacy and the safety of our patrons, that's my number one goal, safety, privacy of our patrons. What do you need to do this? So I would ask them, do you need your own restroom? Do you need your own room for consultation or for screenings, different things like that? So when you are talking with that partner, once they've decided, hey, I'm coming on board, I'm going to do this health fair, fill them out. What do you need to offer your services? And that will tell you where you need to put them within your library. So we utilized all of our old offices, our old storage rooms, our restrooms, our kitchenettes, whatever it took on that day to make sure that we had safety and privacy for all of our patrons. I will be honest with you, on that day, everything ran so smooth as far as safety and privacy for our patrons. I could not tell you what patrons were HIV tested. And I was all over this library. I was in every nook, every cranny, making sure everything ran wonderfully. But I could not tell you one patron that had HIV testing because everything was handled so discreetly. So you just got to talk to that organization about what you need at that library to make that successful. So like with our health department in UK that did the HIV testing, that was the first thing that I had to ask them is, what do you need from us? That way I knew how to do the setup, the logistics, going back to that one slide, the setup and the logistics of that health fair. You have to know where to place your people. If they're just there giving away free stuff, kind of like how Adonta was and stuff like that, you can really put a table anywhere and set them up. But you got to get down to the nitty gritty of what those people need, like vision screenings. we utilized our assistant director's office. We took, and moved everything the best we could out of her office that day, covered stuff up, whatever we needed to do. We did vision screenings in our assistant director's office. We utilize every nook and cranny of this library to make sure that we are giving our patrons 100% the absolute best in privacy and safety.
Thank you. I guess I assume your patrons didn't have, your library customers didn't have any kind of that, since you all had addressed it already. Did you have anybody say, any of your library customers, patrons, say anything that they were concerned about privacy or?
Oh no, and we already have them asking, have you set the date for next year's? We're ready. We're coming back. I kid you not, this morning even, because I've got chair aerobics going on in the room next door to me this morning,
Yes.
actually. And a couple of them that are in chair aerobics, they're like, hey, Miss Holly, have you set the date for the health fair yet? And what's going to be free this year? Like, wow. And that's just stupid. That's a husband and a wife in my chair aerobics class next door. But so no, we had no kickback whatsoever from this event. And like I said, everybody's like already chomping at the bit, wanting to know, if it's coming back this year again and what's new and what's free. And so, I mean, this will definitely be one that I will continue to do every single year. And we're going to we already have our date set. It's set for the first Saturday in January again this year. And we are going to be growing and expanding. So we're going bigger this year even than what we were last year, and reaching out to, more organizations and trying to offer more free stuff. And so, and that's the goal, is to grow and expand every single year. I say I would love to grow and expand it to the point we outgrow the library and we have to go somewhere else, but I really don't want to leave the library either.
Understand. No, that makes sense. I've got some more questions, but I'm going to pause here and let anybody who is in the audience feel free to type your questions in the chat. Well, I'll go ahead and type if you feel we've got plenty of time. But another question I have is, what have you found to be effective way to get feedback from your event, either from your partners or from those who participated, the customers?
Absolutely. I will be very honest with you. Just basic word of mouth, day of and in the days after. Our patrons constantly wanted to come up and talk to me about it. Or they would come in and get more resources. Oh, I seen that they were here at the health fair, and but I didn't grab that pamphlet. Did you have any of those left? Or, but also we are so still, I guess, rural and simple here, that most people would still rather fill out like a paper evaluation for us. And that's what we did. We just did a little basic survey about, what did you like about the health fair? What did you dislike about the health fair? What would you change about the health fair? Just comments, suggestions, different things like that. And that's kind of ultimately what we did across the board for, patrons, but also for our organizations that were here. And it's already, like I said, it has opened doors to more resources, like knowing that, okay, we had this, but now we want to grow it and do this, different things like that. So basically, I'll be honest with you, I mean, a lot of our patrons, especially, your older generation, they just want to tell you word of mouth or do it on a piece of paper. So that's kind of what we did. We just developed a short little survey, and our Clearing the Air Coalition even partnered with us. I serve on that board, and they partnered with us, and they actually gave surveys to people as they come by their tables that day to find out like what resources and stuff like that, we could be utilizing better. And so it's just, I mean, and ultimately, if you have your organizations, asking and polling and, those types of things while people are here, they're going to get good answers, maybe different answers than what you're getting even. So it's just, it all boils down to that community partnership, word of mouth, and getting that feedback. But mainly, like I said, word of mouth and paper surveys have been what has helped me to start to develop and plan and create what we will have in January 2024 now.
Great. Would you be willing to share those questions if
Oh
folks?
yeah, absolutely. Absolutely.
And then what it's interesting that your partners also were doing surveys, and they may not have been able to share, but were they able to share their survey, what responses they got with you?
Yes, they actually did. Like I said, mainly it was our Clearing the Air
Hmm.
Coalition. So they were able to get us information on like, smoking and vaping and like those types of things, stuff that like maybe necessarily my survey didn't touch on. They were able to get us that extra feedback to know if we needed to do programming on smoking or vaping or different things like that. And I mean, ultimately, like having your local gyms, different people like that set up and asking those people, hey, if I taught a class here at the library, would you come? And, so I mean, stuff maybe I didn't even have on my survey, like what type of class would bring you to the library.
Hmm.
Those people were able to find out for us because, they were teaching a small little session that day, and so they were able to ask during that session, or as people browsed their informational table, they were able to say, hey, if I offered a yoga class once a week here at the library for free, would you come? I mean, and it was just so they were able to give us even more feedback than what I even anticipated. So like I said, that has now landed in us having once a week yoga, once a month meditation, because that filler was out there. It was put out there at health fair and people seen that it was an option, and there was nowhere in the county, offering it. So it was a great ticket for the library to snatch up, and like we pay, I think we pay like it's free to our patrons, but we pay, I think it's like $25 a month to Our Lady that teaches meditation, and that's it. So for $25 a month, she comes and teaches meditation for us. And she also teaches art to my kids. So she does an art class and a meditation class for us. And all of that stemmed because she was a health fair organization vendor person, who we were able to find out what she could offer. So that's why I say a library is way more than books.
Yes. Well, and you just touched on something else I was going to ask, and I don't know if other folks have been interested in this too, but you mentioned that this is a great way to offer free. It wasn't as much a hit for your budget, but how do you budget for this? For making flyers, or what kind of cost do you associate with this? And then any of the outline programs that come, or the programs that spring from this.
hmm So my library director actually gives me like a programming budget each year. Like I said, I do programming for children and for adults. So I have a budget kind of set aside for both adults and children, so that I kind of have perimeters that I know I need to stay within and those types of things. As far as like this, honestly, there was minimal cost to hosting a health fair at my library, at your library. I mean, we did, some paper flyers, different things like that. I mean, you're maybe looking at like if you do a color flyer and you're printing it and hanging it up somewhere, that might cost your library, if you're lucky, maybe 50 cents a page. So it is really minimal, like to print flyers to take out and hang with the organization, like within the buildings of the organizations that are going to be with you. But I always say use those free platforms. Facebook is free, Instagram is free, TikTok is free. Use those platforms. They are free. I am a huge advocate. That's why I put get in touch. I always handle and run our library's Facebook page as well. But when I hired in, we kept hearing, oh, the Facebook algorithm is going to like mess up with all of our posts. They don't want to, let people see our posts and stuff as much. And so I was like, oh, no, that's not going to set well with me. We're going to figure this out. So that's one reason why I have my own personal Facebook, of course, which is just Holly Darty, and I share all of my library stuff to it too. But that's another reason why I started these two social media accounts on Instagram and Facebook, the Miss Holly at MCPL, is that way I can take what I share out on the McCreary County Public Library page, I can share it to the Miss Holly at MCPL page, and then I can share it out to the Holly Darty personal page, and then any Facebook groups. Like I admin and oversee a lot of Facebook groups for McCreary County as well, and I have the ability to share it all out in those groups. So it's just like a ripple effect of waves. What once sat on the McCreary County Public Library page now is going to ripple effect all over Instagram and Facebook and TikTok and all of those, and it's all free. It did not cost our library one dime to create a flyer using Canva or Microsoft Word or whatever. And like I said, you create that flyer on Canva, Microsoft Word. If you print it in color, like I said, you might be out 50 cents. If you take those out and hang those up in your organizations or, in your local businesses, you're not going to have much money in this event or any really event in that. And when you partner with these people, like you're promoting their business as well. So half the time they'll do it for free or for a minimal cost. Like I said, our meditation lady charges us $25 a month to come in and teach a 1-hour meditation class. And then she also teaches an art class, step-by-step art painting class with my kids, just because those connections are made. Same way with Pound. Our lady that taught our Pound class was here the day of the health fair, and that trickled into her coming and teaching a once a month Pound class for $20 a month. $20 a month. I mean, honestly, like you go and buy a coffee from Starbucks or your local coffee shop, and you're going to pay $5 or $6. But our library will pay that, and our patrons get it for free, so it doesn't cost them a dime. If you partner with your extension office, almost all of those programs are free. We do not pay a dime hardly for any of our extension office programs, cooking, arts, crafts, any of that kind of stuff. Like I said, our extension office is in there teaching my chair aerobics class right now, 2 days a week for $0. Absolutely free. Make those partnerships. It will help your library grow tremendously. But it's just a matter of watching your budget. If you're not given a budget, maybe like my library director gives me, just be mindful. I mean, we all have to watch a budget to live every day. Just be mindful of, what it's costing and what you can get for free. I mean, that's ultimately what I always do. I mean, I reach out and I say, hey, what would you charge to come and teach this class or to do this program or whatever? And I mean, like some people will say, oh, I'll do it for free. I just thank you for helping me get my name out there. Those types of things. I mean, we have an upcoming event in October actually, and I have a live band coming to play for free because they just wanted their name out there. So, I mean, it's just those partnerships are formed, you just got to keep building them. And this event in itself is a huge building, stepping stone to community partnerships.
Miss Holly, thank you so much. I see David. I don't know if you've seen this comment from David, but I wanted to let you see that. Looks like a great event. He's from the Lexington Public Library. So thank you, David, for that comment. And I'm going to drop in the chat a link to a survey. We ask you to fill this out and let us know what you thought of the webinar. Appreciate your, if you have any other questions, I'm going to go on and put up the LSTA, thanking the IMLS for offering this webinar. But I do want to thank again Miss Holly for presenting and her energy and passion for helping her community. Thank you to the Institute of Museum and Library Services for this webinar, for making this possible. If you please fill out the survey and let us know what you thought so we can continue offering webinars like this. And I thank you again to Miss Holly. There are the slides for today's webinar are available in your course. for hosting a health fair at your library. A certificate of attendance will be available in your learner dashboard within a week if you're watching this live, and or if you're doing it through the portal, you can get your renewal credits through your account that way too. And thank you, Mackenzie. Thank you all so much. Please feel free to reach out to Holly. I'm going to drop her email in the chat again, even though it was on the slides. If you've got questions or want to reach out to her directly, certainly can do that. And just thank you all so much for being here today. Thank you again, Miss Holly, for.
Well, thank you guys for having me. I loved it. Loved being with you guys.
Same here, and just all the passion you brought to this and the way you're helping your community members. So thank you all again.
Thank you guys. Have a blessed day.
You too.